Healthy sex is all about pleasure and enjoyment for both partners. Both should be involved, and satisfied sex involves friction, but with enough arousal and lubrication it shouldn't be painful. Pain and discomfort can be a sign of something wrong during arousal. Increased blood flow to the vagina causes fluids to pass through the surface of the vagina. Secretions from the uterus vestibular and Bartholin's glands produce lubrication to reduce friction and increase comfort during sexual activity. However, under certain conditions enough lubrication may not occur as easily. Lack of lubrication can cause friction and less elasticity of the vagina during sex, which can lead to tearing. Vaginal injuries during intercourse are tears or cuts in the vaginal tissues. It is a common condition that can cause pain and discomfort during sex. It may cause a burning sensation, especially during urination in the vaginal area, and changes in the vaginal discharge. Minor vaginal injuries are usually small and heal on their own within a few days. However, more severe tears can cause significant pain and bleeding. Sometimes they may need stitches. While there is an increased risk of infection, lubrication is a natural part of sexual response, but it can be affected by various factors. Hormonal changes, especially a dip in levels of estrogen during breastfeeding and menopause. Medical conditions like diabetes, Sjogren's syndrome, a disorder of the immune system which can cause dryness of various mucosal organs like the vagina. Some medications like antihistamines and antidepressants, certain birth control methods, dehydration, not drinking enough fluids, anxiety and stress can also affect vaginal lubrication. Using a water-based vaginal lubricant and moisturizer can help reduce friction and discomfort in these situations. Sometimes a person's lack of knowledge about arousing their partner can contribute to reduced lubrication and a painful sexual experience. Focusing on the wrong areas or misinterpreting their partner's physical responses might not be stimulating enough to trigger the natural lubrication process. Friction from rough intercourse that is forceful can also irritate the vulva and vagina and cause micro tears in the vaginal tissue, leading to soreness, burning or stinging. Pain can hinder enjoyment for females and prevent achieving orgasm if intercourse is painful with discomfort and side effects. It can make females associate sex with negativity, leading to decreased libido. It can cause frustration and tension in a relationship and increase distance between the couples over time. Every human is unique in what arouses them. There is no one-size-fits-all approach. Experimentation and communication are crucial to discovering what works best for you as a couple. What feels good for you might be different from what others find arousing.